For those with a sweet tooth who don't want or need all the sugar and calories for health reasons, alternative sweeteners are popular. Sugar-free products on store shelves are easy to grab and go. But investigator Dr. Gary Patti is on a mission to connect the dots between diet and cancer. Patti's a professor of chemistry at Washington University in St. Louis and a professor of genetics and of medicine at WashU Medicine. He's also a research member of Siteman Cancer Center, based at Barnes-Jewish Hospital and the School of Medicine.
There's no free lunch. Everyone's looking for the way that I can fulfill my sweet tooth and not have any of the negative consequences. I can have the pleasure, but not have any of the negative consequences that might be associated with glucose or now what we know about fructose.
His research team had revealed how fructose is tied to cancer. Too much fructose fuels tumor growth in animal models. So, are alternative sweeteners the way to go? Patti's team focused on the sweetener, sorbitol, a sugar alcohol that's commonly used in sugar-free products like sugar-free Jell-O, gum, candy, ice cream, and desserts. It's also found in drinks like some wines and beer.
Sweet Kool-Aid, sweet tea, that sort of thing as well.
Sorbitol is found naturally in some fruits and vegetables.
It's just like glucose or fructose. It has this similar kind of structure, but it's generally been perceived to be healthier because it's thought that it can't be metabolized as readily as glucose. And because it's not glucose and it has less calories, if we can get them to eat sorbitol, they're probably better off than if they consume a lot of glucose. And I think this research challenges that idea.
In cases of consuming too much sorbitol, Patti's team made some critical discoveries. First, they found that sorbitol can be naturally produced in the gut from glucose.
But the amount of glucose that's required to produce sorbitol has to be exceptionally high. Depends on that gut microbiome, whether it's from the glucose in your diet that's making sorbitol in a secondary fashion or you're consuming sorbitol directly. It's the bacteria in your body, your gut, that define how much of that sorbitol escapes out of the gut.
Next, they discovered what can happen when consumption of dietary sorbitol becomes too much.
So if it escapes the gut, because the bacteria can't clear it, the first thing that happens is sorbitol gets converted into fructose. It's just like eating high levels of fructose, because at high levels of fructose, you drink a Coca-Cola, what happens? You put a lot of fructose in your liver. And in this pathway, with sorbitol, whether you eat a lot of sorbitol and you can't get rid of it because your gut microbiome doesn't have enough power, or because you've consumed glucose and it's converted into sorbitol and you haven't been able to clear it, you end up with sorbitol in your liver, which makes fructose, and we're right back to where we started, which is bad for cancer, which is bad for metabolic disease, which is bad for liver disease. It's bad for diabetes.
Then what about all the other artificial and alternative sweeteners and products and packets on cafe and restaurant tables?
There are other reasons that those sweeteners that you mentioned could be dangerous as well. Yeah. To produce that taste, that flavor, chemically, the structure of those different substances are pretty similar. So I think there's no free lunch. Unfortunately, there's not one here that you can say is going to give you the pleasure without the potential risks that it could pose.
More research is underway.
If you can modulate your diet, and if by adapting your diet, you can influence either the onset of cancer or the rate at which it progresses, that's something that you can control. I can decide what I want to eat, and it may be hard. I like chocolate cake as much as the next person. It may be difficult to do, but it gives you some level of control because there's no destiny. Your destiny is as you shape it, but you're making that choice.
And take a closer look at the labels.
I consume protein bars for lunch, and I was just like anyone else, trying to find the healthy protein bar, and my protein bars contained a lot of sorbitol. Unexpectedly. I happened to be looking at it one day. That's the one thing when you do research on these sorts of things and then you realize you don't expect it to be related to you. And then one day I flipped over my protein bar and noticed the concentration of sorbitol, and it was much higher than I had anticipated, which I will tell you I no longer am eating those protein bars anymore.